So we're going to talk about a rare condition that impacts the nervous system with symptoms reminiscent of polio.
Polio. So the CDC has confirmed about 40 cases so far in 16 different states, including Pennsylvania. We know of 3 in Pittsburgh, as a matter of fact. And last month, let's see, a local 2-year-old girl was treated at CHOP. Dr. Caudle is here. We talked about this earlier in the week about the Minnesota cases.
Right.
Well, it's, hopefully it's just going to stay there, but no, now it's in all these different states.
Right.
I'm so old, I remember doing this in the late 50s. I stood in a line like that to get a polio shot with my whole family. My mom, dad, all 6 of the kids stood in lines like that.
Amazing.
We thought polio was eradicated. This isn't polio,
right? And that's a good point.
But it's polio-like.
Right. This is not polio, but it's polio-like in that the symptoms are similar to what we've thought about with polio. Children can get muscle weakness, arm weakness, leg weakness. They can have facial weakness, drooping of the face, problems swallowing, almost stroke-like symptoms if you think about it. It's muscular issues. And you did mention that, yes, we're seeing it in a number of states, but I do want to reassure parents and everyone, it is still very, very, very rare, which is a good thing. Overall.
Yeah, 38, 40 cases out of 340 million people.
It's still less than 1 in a million cases. It doesn't make it any less important.
No.
And I think one of the things that's really scary about this, honestly, as a physician, is we don't exactly know why this is happening. We think that viruses may be at the root of some of these cases, but we don't know all of them if viruses is the culprit. It could be viruses, it could be environmental toxins, it could be other things, genetics. There's still a lot of questions we have. I think that's a piece that's particularly scary.
That doesn't reassure us,
Right, so does that mean in this case it's not a factor of trying to prevent it from happening, it's noticing when it is starting to happen?
I think, Alex, I think you're right about that. That's what we can do right now is that, look, parents, if your children, if there's symptoms that you can't explain that don't seem right, no matter what they are, you get them to medical care. But, as health professionals, we are saying because this may be related to a virus, and I say may in some cases, we're saying make sure that you're up to date in your vaccines, make sure that you're washing your hands, make sure that you're using hygiene. If there's any prevention, it may be that at this time.
Okay, so because we don't know.
I know.
We don't know anything.
It's frustrating. I know, it's frustrating.
How would it possibly spread?
Well,
there's my spit or
you
something?
mean is it contagious from person to person? I don't know that we have any evidence that it's contagious from person to person at this point. No, I don't think that we're thinking that. At least the CDC hasn't mentioned that on their website.
So why it's so scary? We don't know anything about it.
Well, I know, and that's why I don't want to be alarmed. I mean, yes, it is scary, and this is why the alert is for any change in symptoms with your child or yourself, honestly.
I think we have some footage of the little boy in Minnesota. He couldn't, he was fine one day, and the next day he can't use his hands.
He can't literally move blocks and toys. And that's the muscle weakness, right? Almost like stroke-like symptoms. You can see here he's got problems actually sort of using his hands and things like that. And that's the scary part about this. It does seem, Alex, you mentioned that one of the children got a little bit better. Physical therapy is often recommended for children who have this to kind of regain some of the strength.
All right, but real quickly, we better go over it again.
Yes.
What should you look for in your kid?
Okay, muscle weakness, problems using their hands, problems using their legs, problems walking, moving, playing toys, facial weakness or droopiness, problems swallowing.
Okay, just like you said. Seems like
almost
a stroke.
like stroke-like symptoms, right? Almost stroke-like symptoms.
Doc, thanks.
Thank you.
Thank you.